Capitalism.
It kind of makes sense, right? Where I talk to the doctors, right, there's like about that allow you to get paid passively. You're not using your time, and doctor's hourly rate is, but you have staff members who hourly rate could be, and you're not directly involved, but you're overseeing that passive revenue you generate with some of these remote care programs. Think of it like this: the reason why you're not valued as much because but if you can create programs that don't rely on you, then you can be valued more, especially if you have recurring revenue models like, because that's money that's coming every month.
The process of how doctors' incentives. Could you just elaborate as to what that incentive structure is for a doctor? So you say a third party is the one paying them, and they're not necessarily always incentivized to give the patients the best care. Yeah, can you just explain that for someone who might not even know medicine that much?
Absolutely.
Curious.
Well, you're a finance guy, right? There's a thing called the agency problem, right? And so they're not aligned. So if you have a financial planner and they're not incentivized to, how well they're performing your portfolio, if they're working with you, then guess what? They're not gonna do as well because they're not aligned. So that's one area. So when you don't have people, there's not incentive alignment, then people are at cross purposes. And so likewise, when it comes to doctors, what happens is they do the service and then they bill it with these called CPT codes, right? Any service they do, they have to put into their computer or to the EMR, the electronic medical record, and then basically a third party, typically Medicare, Medicaid, or third party insurer like Aetna or United Healthcare, they're the ones who justify if this patient can get the service you already delivered and how much you're gonna get paid for it. And so now the doctor's like, wait a minute, I saw Jack fix his arm. They paid me 20% less than they paid last time. What happened? Oh, well, Jack didn't qualify. You didn't call us for what they call prior authorization to determine if Jack could even get that procedure, or we just decide that Jack no longer qualifies. And so that's the frustrating part, that whole process of getting paid. And so when the doctors realize that services that they would have done okay and still okay getting financially incentivized for, they realize that, I can't do that service anymore. So Jack, I can't fix your arm anymore, but if you need surgery, I'll do that because that's going to be higher value for them, and that's given. So it's
higher value.
Yeah. So and because they see how much money, and I'm not saying that doctors are egregious with this, but it just may seem like you're getting pushed to more of the higher type of surgeries, or they may not see patients like you at all, and is focused more on the patients who need the higher value type procedures and services, right?
Capitalism.
When you break it down like that, it's it kind of makes sense, right?
It does.
And if you can kind of align, so where I talk to the doctors, right, about is well, look, there's about 35, 40 different codes that allow you to get paid passively. So yes, they're not a huge amount of dollar from a profitability standpoint, but if you're not using your time, and a doctor's hourly rate is $100, $120 an hour, but you have staff members whose hourly rate could be $21, $22 an hour, and you're not directly involved, but you're overseeing, that passive revenue you generate with some of these remote care programs is almost like you're having the additional revenue coming in. You're a finance guy, right? So what I talk to doctors about is look, think of it like this. The reason why you're not valued as much because you're so into practice. If you're taken out of practice and so someone's supposed to buy you, then it's not gonna be worth as much because it's dependent on you, right?
Very
the patients
well
know you. They know who you are.
100%.
And guess what? If we try to replace your stuff, we're not gonna get as much money for it, right? But if you can create programs that don't rely on you, then you can be valued more, especially if you have recurring revenue models like remote patient monitoring, chronic care management, because that's money that's coming every month as long as the patient's on the program.
And then is that what you help them with?
Yeah, exactly. So that's kind of what we do. We talked about it in our book about practice value creation, just understanding and breaking into how practices can create more value.
It's interesting because YouTubers, you're talking about a Mr. Beast type guy.
Yeah.
He'd obviously buy the channel, but first off, he wouldn't want to sell it because it's his life, but the value is tied to him as a person. Less now because he has the whole operation down
Feastables, some other stuff
he's got. The face. He can't he can't be in another, he could, and they just use an image from before, but what you're saying for doctors, I go to Dr. Greenbaum, if it's not Dr. Greenbaum, I'm not going to that office,
Exactly.
And that's
the
what
value's tied to him, the doctor himself. And not saying that it's still not tied to him, but it's something that is not taking his time, right? People always say time equals money, but no, time is way more valuable than money. And so if you can take out your time and still get revenue from some services, then I think that's where a lot of doctors need to get to.
Doctors aren't trained like that because they're trained to, they go to medical school, they study, they put their time in to then make a lot of money. They get paid for the work that they do, the help that they give the patients. So they're used to trading time for money. But I was talking to a guy before, And he said it really well. Like, doctors are extremely smart in their niche, great with that specialty, but everything else, they don't really know. But they think they know, so then they think that this money valuation in their head is accurate, but the reality is, if they take themselves out, it actually makes the business 1,000 times more valuable, and they just don't see it like that.
When you are biased based on your limited knowledge set, so just because I know everything is about Fast and the Furious movies, right? Doesn't mean I'm a director, right?
Yeah, of course.
But she's like, oh, I know how the cars are set up and all that. But do you actually know that there was a movie that just came out? I want to say it was called The Menu. It was like a horror film. It was Ray Fiennes is in it, and
we were talking about this, The Menu?
Yeah, The Menu.
I don't know the movie, but we were talking about that this weekend. My friends and I just brought that movie up for some reason. I don't know.
So yeah, it's kind of interesting. It's basically these foodies, they get together, this classic food celebrity chef. He's been missing for like forever. He opens up this restaurant finally, and it's like so exclusive. You get a special invite, and it's off on the island, and like only special people get to go. And this is his last menu. He says, I'm not gonna cook anymore. Go see the movie, I'm not gonna spoil it, but basically craziness happens. But the point I'm trying to make is, one of the foodies, he's sitting there and taking pictures of the food. He knows everything about the food. Look all the elements he did to create it. Oh, he boils it to a certain degree, so he knows it intellectually. The chef says, oh, so you know it. Well, go ahead and cook it. He's like, what? So when he's starting to cook, and he doesn't know it, right? But he knows it intellectually. And likewise, I use that example to say doctors, they know especially pretty well, but then when it comes to like finance or just run their practices, it can be a little misleading, and they get a little overconfident sometimes. And that's why consultants like myself can come in and kind of guide them. We do things like practice audit, where we go in and kind of look at their practice. We can look at their billable claims for the last couple of years, see what CPT codes they missed on that tie into these billable codes that we talked about, that's passive revenue, and see opportunities that they missed that they never saw before. And so I think the hardest part is just that doctors have to realize that I may not know everything, but I can get someone that I can trust. And we try to provide value on talking about this from a video standpoint, so they can feel like we understand their background, what their care abouts, and how we can get to the next level. So that's why we do this and talk about building value for practices and medical practice specifically.
I didn't even realize that this was part of your offering.
Yeah.
I was thinking just telehealth, but that's
the beginning part of it, because now it opens the conversation.
That's
more.
your lead. Yeah, it's a leader.
Yeah, it's a lead offer where we kind of say, hey, well, you don't know where you are unless you put a point in the map and say, hey, this is where you are, right? Like when you go to the mall, right? They always say, so how do I get to Macy's or whatever? Well, first you gotta know you are here. Where's the red dot? And then from there, you can kind of turn that's dated reference. I don't know how people go to malls anymore, but then you can find yourself, where you need to go. And so our goal is to kind of say, hey, this is where you are. Here's how you can get there with these steps. And that's when we talk about the remote care programs, but also there could be things like operations you need to do. Like, what are the things in operations that you're not hiring enough mid-levels? So mid-levels for doctors would be like nurses that can come in and kind of offset some of the services that you offer to your patients. What are some of the things that you're doing from a financial standpoint, like your taxes? Are you taking advantage of tax rebates and things like that? What are you doing with marketing efforts, right? How are you kind of communicating and getting patients into your practice? So all these things, I think are some of the things that we try to offer, because we want to create the most value, right, for the practices long term. And that's why we came up with the practice value creation. Thank you for listening. If you like what we just talked about and you want to learn more, click either to the right or to the left, and you can find out more information about how we can help you this year.